Dawn's ready.
Oh, it's 6 o'clock. Oh, my God. We don't have to wait until 7.
No, I don't want to wait.
Well, different thingamajiggies. I feel like Larry King now. Should we start? It's 6, yeah.
Is that a yes?
So what?
130,000 square feet. No, he's dead. Isn't he dead?
Dylan, you ready up there? One sec.
Sorry, I'm in like a meeting fog.
So what did they add?
No, no worries, no worries. Make sure that all these.
Yeah, I don't know if we're waiting for a thumbs up or.
I know, it didn't take long.
Are we waiting for a thumbs up, Dan, or?
Yeah, that's my understanding. I think we have some new staff up there.
Okay.
All right, Dan, the Zoom audio is fixed. You should be good to go.
Awesome. All right.
Okay, the meeting will now come to order. We'll begin with introduction of members, and we will begin with town staff.
Dawn Geit, Recording Secretary.
Dan Beret, Town Planner.
And do we have Carrie on Zoom? Okay, Carrie may be joining us on Zoom at some point.
Dylan, if you see Carrie Olson on Zoom, let her in at any time to speak.
All right, yep, so far she's not here.
Okay.
Okay, and we'll begin with introduction of commission members, beginning on my left.
Victoria Chechet.
Bob Ellsworth.
Chantel Foster.
Jennifer Talone.
Robert Taylor.
Carolyn Freeman.
Joe Spada.
Okay, we will not be seating any alternates tonight. So may I have a motion to accept the agenda as presented? And a second?
Seconded.
All in favor, say aye. Aye. Opposed, say no. Okay, the agenda is accepted as presented. Meeting procedures, we will be instituting a 5-minute time limit per speaker per session. That doesn't mean that you can't come back up and speak a second or third time. And this is for members of the public. It is not for the applicant. So we will then move on to this public hearing, the purpose of this meeting, and it's for application 23-20, proposed amendment to the Portland zoning regulations, add quote, "healthcare institution," end quote, to section 9.17.2.b of list of allowable uses. Add footnote to 9.17.2.b that states, quote, "For purposes of this section 9.17, number one, commercial use means any use set forth in this section 9.17.2b as being recognized and permitted in a mixed-use development other than residential units, and two, residential units shall exclude any beds or units within a healthcare institution," end quote. Add text to section 9.17.5.f, quote, "Notwithstanding section 5.2.b, no single commercial establishment within the mixed-use development other than healthcare institution shall exceed 65,000 square feet in gross floor area, and no healthcare institution within the mixed-use development shall exceed 130,000 square feet in gross floor area, and no mixed-use development shall contain more than one establishment of maximum size, with all other establishments not to exceed 40,000 square feet in gross floor area," end quote. Application of BRT DeMarco, PTP LLC. So may I have a motion to open the public hearing, please? A second? Second. All in favor, say aye. Aye. Opposed, say no. Okay, the public hearing for application 23-20 is open. Would someone like to speak on behalf of this application?
Good evening. I'm Dave Daniels. I'm the attorney for the applicant.
Okay, good.
And I'm just going to just present a summary of the text amendments that you just went through.
Okay.
Just a bit more detail.
Oh, we're gonna have to turn around again. Oh, God.
I think we need a PowerPoint.
Presentation.
Yeah, we got it. Thank you.
Let's just see what we're looking at. Okay.
Everybody see that?
Sure. Is that a trick
Great.
question? Sure.
Yeah. Okay. Could you please go to the second slide? That's great. Thanks. So as the chairman mentioned, what the applicant is proposing is amendments to section 19.17.2 and section 19.17.5. The next slide, please. On the left-hand column there, that's the list of permitted uses in a mixed-use development. And as you can see in the larger font down at the bottom, healthcare institution is the use that would be added to that list. And then on the right-hand side, the amendment to 19.17.2 would be to clarify what a commercial use is, and basically it would be any use that's recognized and permitted in a MUD other than a residential dwelling unit, but within a healthcare institution, a residential dwelling unit would not be deemed to be a commercial use subject to the density limitations, so long as 100% of the units are occupied by at least one person who's the age of 55 or older, and as long as the development also meets the applicable federal requirements for that kind of a senior housing facility. Next slide, please. And the other change is that in terms of the maximum square footage, the current limitation is to have a single building that is no larger than 65,000 square feet, with all other buildings being limited to 40,000 square feet or less. The change would be to allow one single building to be up to 130,000 square feet if it is a healthcare institution, but then any other building still that can only be one building. Any other building would have to be 40,000 square feet or less. So it just changes the requirement for that one building if it is a healthcare institution. And that's all we have.
Thank you, that helped.
Good evening, everyone. Dan Bertram.
It did,
So that is the presentation for what we're actually proposing tonight. I figured I'd give 2 minutes on how we got here, and then kind of probably close because there's not a lot to it. We were here for all the reasons that we talked about recently in terms of the challenge of developing and looking for creative ways to find a solution. We proposed one, but in the discussion back and forth, we got additional insights. And so I would throw out a couple things that probably weren't in the presentation. Number one, this healthcare institution is a permitted use in the B3 zone, which is what this parcel's in. And so this is just the application of it to the mixed-use development. And we came to this by collaboration with the town by saying, well, everybody kind of liked our new B building, and we were trying to figure out how to do it, which required the A building to cash flow in some way. And so this use on that southwest portion of the site is what we were trying to figure out. So we came back and said, well, a healthcare institution, if it's just on a B3 parcel, which is what the zone is until the overlay kind of becomes a controlling mechanism, can only go to 35 feet. And so we were talking back and forth, so because the mixed-use overlay zone allows for additional height, that additional height allows for the view shed to be improved for the historic things. So just a number of things came together, and in conversation with the town, the idea was to propose this to become officially part of the MUD, and then it would allow us to both do some of the stuff that we talked about on, replacing the CVS with the 32,000 square foot B building, but also giving us the building height that would give us a platform from which to do the rooftop restaurant. So kind of all the concepts we came up with for this would be an enabling mechanism for essentially a age-restricted population for all the spots within this building. And it addresses some of the discussion that had come up in our prior conversations, one of them also being potential impact on schools. There would be no school-aged children related to anyone living in this healthcare institution. So there's a broad definition of the services that are involved, and we're certainly looking at healthcare institution from the sense of one level of service beyond active adult. Active adult being purely age restricted with no services, and then independent living being one click off of that. So that's the broader context. I just wanted to explain that, and I certainly can answer any questions, but it actually ends up being kind of an interesting solution, because in the end, as applied to the site, we end up with about 195,000 square feet of commercial space, in addition to the 240 apartments. And then if this were approved, we'd be in talking about a site plan modification, and the apartments that we think would end up in this building, we would also age restrict. So the entire last building would be 55 and older, and pursuant to that definition that David read earlier. So that's why we're here, and certainly can answer any questions, but that concludes our presentation.
So, who wants to start?
One thing I want to point out is that our definition for healthcare institution is outdated. I know that Connecticut General Statutes has a bit more broader term or definition of it. And so I'm assuming at some point we're going to probably want to update it so that it reflects that. And I don't know if that's something we can do part of this, or if that's something we have to do completely separately. But it would make sense that, they kind of, we look at it in that respect, that we're looking at it, the broader term as defined in the general statutes versus what we have in ours, because ours is probably going to change soon.
Can I ask you a question about that? If it doesn't specifically say healthcare institution, but is more limited to describe what they want to do, then statute doesn't have to change. Then we don't have to change the text, right? Let's say they say senior housing with a certain level of service. So it becomes more specific and not as broad as our definition in the regs of healthcare institution.
Well, wouldn't that need to be defined though? Whatever it was, it would have to be defined.
I would think so, but not necessarily in the regs. It could be defined in this text amendment.
So part of the reason.
More specific.
Part of the reason we've kind of proceeded the way we did with this text amendment is we had our initial conversation with Dan to try to understand, what solution he could bring to you guys that would work for him and would still be entertained by the town. And so we were trying to work within the confines of his application. So certainly I do agree healthcare institution needs to be updated. We've had a conversation with Carrie, who is now on. There are sections of that definition that if you read them, you can see that terminology is no longer acceptable or used. And so that's a big part of what we're going to change. There's a specific word in there. I don't need to reiterate it. But also, it's talking about like an institution for tuberculosis. I don't think that's right. So certainly that's something we could do. We just can't do it in this application. We can't add a new defined term or define healthcare institution.
But can't we just eliminate the words healthcare institution and have it be, because I think Carrie mentioned that you can narrow things down, but you can't broaden them. So we could, instead of saying healthcare institute, I'm just throwing it out there, we could say, senior housing.
So, well, Carrie, you can chime in whenever you'd like, but I don't think, so we need to add a use to the table in order for them to proceed. Right. And the closest one that we could find on the books was healthcare institution. So that's why we went with that.
I'm happy to weigh in. I agree that even though the current definition of healthcare institution needs to be modified, as it is currently written, what they are proposing meets the definition. It's just a type of healthcare institution under your regulations.
Right.
So down the road, you can create new and more specific, if you will, uses, like senior housing. But my understanding is that this is more than senior housing, that this is going to be more like assisted living, and it's going to be geared towards making sure that at least one of the individuals occupying any of the units or beds is a 55 and over. So, so again, because of the fact that it is also assisted living, and there will be services provided on site. It currently meets your broad definition of healthcare institution.
So,
Could you just, I was told nobody could hear you, so,
oh, I'm sorry.
yeah, you're good.
I am?
You want
Okay.
that close?
Are you intending this to be senior housing, or broader than that? Where just, I mean, how are you thinking about this more specifically?
Sure. So yes, senior housing. The term we use when it's just an age restriction is active adult, and that is something that has no service component to it. It just is a pure age restriction.
Okay.
We are hoping to have as vibrant a community as possible, to have the vibe of the rooftop restaurant be what we want. And so that is something where, because it's on, we plan to do that amenity on top of this use, then we want as healthy and vibrant seniors as possible to populate it. And so across the spectrum of age-restricted housing with different services, it kind of goes active adult, then independent living, which is what we would argue is appropriate here. Then it gets into assisted living, convalescent care, and then it just kind of goes into the hospital spectrum, right? And so we're not looking to do wildly, involved services. We're just looking to have some and limited, just because of the juxtaposition with that restaurant that we're hoping to do.
Okay, so just to be clear.
Yep. Independent living.
The age restriction will be across the board for every resident 55 and over.
So, well, the housing, the idea is that if one spouse qualifies for this type of housing, presumably they're maybe closer in life to needing services. And if they happen to have married someone younger, that person can still live with them. So it's one resident of a unit meeting the 55 or older, but there are then restrictions on children and things like that that cannot be part of that dwelling unit.
Okay.
Okay.
And then independent living is the level of care that you're.
Right, exactly, which is limited in scope.
Okay.
If I just may say one other thing, one difference between what you're saying with senior housing is that we would view that more as residential. If there was no services, well, because there's services here, this would be a commercial use.
But that's what I want a little more, better understanding.
Well, so,
of
and
what the
again,
actual
Sure.
services-
I just want to be careful, and Carrie, I don't want to get too specific on the site. I know we are very site-specific, but this is a broader use for the whole MUD, and I know we've been much more site-specific than we normally would be. And I think I can try to accommodate you there.
Well, and I think I can speak in some broad strokes here,
Okay.
because we had to do a deep dive in the commercial, with regard to the commercial demand for this type of facility. And so some levels of services are coordinated runs to, outings and social things, right, for the population living there. Others are basically services that are, a nursing level, medication follow-up, that kind of thing, that are facilitated at a facility like this, but that are not necessary for all residents to pay for, right? It's just an available service. So the concept is that because these things have gotten so expensive with the, in terms of senior living with lots of services, there's been a lot of innovation in the space where they've tried to kind of create active adult housing with minimal services. And that's the model we're looking to pursue here. And I think it's the best way to have it blend with what's going on with the rest of the development and the proposed commercial uses for the other spaces, be they retail or office or otherwise. So, but the services would have Available services would have some limited medical component, but not heavy duty, as you would have in a convalescent home.
So when I think of independent living, these are the services that I think of. Independent living. There's one meal a day provided for the population. There's housekeeping. There is medical checks. There's staff on site in case something goes wrong. There's activity coordinated. There's, stuff like that.
Sure.
So that's what I think of when I think of independent living. And I'm not hearing that.
No, it's more diluted than that in terms of the services that we contemplate. But still having the ability to have a meal within the, because every unit would have its own kitchen, and the design is similar, because a lot of the stuff that was always contemplated were universal designs. They're levers, they're large doors, it's all handicap accessible. That's a good best practice with these types of housing. So it really comes down to the amount of services, and that, like I say, is there are differences where you can have a place to eat. I think that is one thing that will be facilitated in our discussions. There are some people on the DeMarco team who have experience with this in New York, and were, frankly, the folks who thought up this use as a response to our last round. So I'm happy to be, having a broad team, I guess, that knows about this. But I agree that there are a lot of perceptions with each term that historically have involved a lot of services and then served a different population. But the idea is to allow, if you take the spectrum, people could move into the unrestricted portion of the site, and as they aged, could sort of slide over to this part and have some more services without leaving town. And so there's an incremental thing. And then if they needed more than what we can provide as it relates to on-site healthcare support, which again will be minimal here, then they would have other options to move from their site.
So I guess I would be very curious to hear exactly what those services are. So what are the services that you would be getting in this version of independent living that you wouldn't be getting in an over 55, just a regular over 55 environment?
So the active adult piece with no services, right?
Those are just apartments. Those are just age-restricted apartments.
Yeah, well, it's a combination of that, yeah, for sure, yes. So hard yes on the answer, but there is a design of the amenity program that's a little different, right? And so there are some tweaks that would show up on that first level of the building where people come in, that there are designs that we've already incorporated internally for how the inside of the building fits up. And so that would be different from the other apartment buildings on site. So this would be a different first floor experience, and then you would go up from there. Now, I would say something that Carrie touched on. This healthcare institution definition in the local regs is very broad. And so all the things we're talking about, from convalescent care down to independent, on the heavy service side, to independent living, fall under the umbrella of the healthcare institution. And so we've looked at that as something that we could really kind of collaborate on a site plan modification to say, well, what's the right balance of services? And I think we could go deeper there in defining what is required for services on the independent living side of things as a condition of approval on a site plan modification. That's kind of the way I would look at this, because if we regulate too many services, then the internal fear is that it will give a different energy to the property that doesn't fit what we're trying to do with the rooftop restaurant. So we want to keep this as vibrant as possible and as service light as possible while still being meaningful services. And so that is coordination of the population that you know and program activities for, but then also some services that are medical in nature that are provided from an on-site service provider. Because it's just the beginning of that experience, I guess, is where we're going with this.
Mr. Chairman, it's Carrie Olson. May I ask a question?
Yes, go ahead, Carrie.
Okay, so I have to say, and again, everything that I heard about this was, secondhand. I was under the impression that it was an assisted living facility that was being proposed. And so I'm a little concerned now, and I do feel, Dan, that an explanation as to how what you are offering meets the healthcare institution definition, I think that needs to be fleshed out. I don't want anyone to come back to me and say, Carrie said we meet the definition, because I understood it was assisted living. And if I misunderstood, that's my problem, but that's what I understood.
No, it's
so,
well, no, I don't. You didn't misunderstand anything, Carrie. It is assisted living. There's a spectrum of services that go with assisted living. But if we were to incorporate this into the MUD this evening and said in a future discussion that this needed to be assisted living, everything I've described is assisted living, because the threshold has to do with on-site services. That is the enabling thing. I'm just trying to flesh out what commonly used terms are in this senior living space have become in recent years. It's evolving, but it's definitely assisted living with services. We want to have it be some minimal level of services to do the rooftop restaurant. That's all. If we went too far down that, then I apologize, because I'm not trying to confuse anything. It is assisted living. There's no question about it. It's just how assisted, the degree to which, and it's something that we can be dealing with in a site plan modification, because that falls under the healthcare institution.
But
Just to add,
Dave, could you just come up? Yeah, no problem.
In order to qualify under a federal program, which is what the statute requires, it's got to establish that it's a federal program designed to assist. They use the word assist in the statute, elderly persons. So that's where you get your requirements. They have to, if they don't have whatever. So the federal government is mandating what those programs are. We can get more specific information for you on that. So
and I just want to be very clear for the commission, because I'm sensing through the questions, and they're very good ones, that there's a concern that this is nothing more than an age-restricted apartment building that would not necessarily qualify as a commercial use or a healthcare institution for purposes of the MUD. And that's so again, thank you for the clarification. The ultimate decision is the commission's, but I just wanted to make sure I hadn't misspoke or misled my commission. So thank you for that.
And I don't believe you have, Carrie, so if that helps anything.
Thank you.
May I?
Yes.
What is the percentage left for commercial if this were to go forward with the 130,000 square foot?
So,
Because this counts towards commercial, right?
yes, the totals would now be much higher. The gross amount is 195,000 square feet. So it gets to be a large number because of this use, right? If you're meaning what isn't assisted living,
No,
would
is
you like
this-
that kind of
Yeah, is this
number?
reducing the amount of commercial that, is this ticking off a box of required commercial square footage.
Per your regs, this is commercial. And so assisted living is a commercial use. And so
Okay.
we are going from 113,000 square feet of commercial that's approved currently in our plan. And Mr. Fonda had gotten 150,000 square feet of commercial approved prior to that, before we ever came to Portland. And we're proposing 195,000 square feet. So we are significantly increasing the commercial base.
So you're leaving 65,000 for other commercial use.
And let's just keep in
Ye-
mind that the numbers being presented here are very site-specific,
Sure.
Okay.
right? Whereas
Well, they're-
we're considering,
They're in the text amendment, the numbers, right? So,
But how it's
Right,
being
there was a
split
limit
up,
on the
how it's
maximum.
being
Oh,
how
I'm
it's
sorry.
going to be split up is kind of being, we're talking about a specific site.
I guess I feel that's the case.
That's, yeah.
okay. How many units will fit into 130,000 square feet? How many
So-
apartment units?
So we have, it's not a subject of this tonight because there's a hospitality component that's planned. So this is on the Building E side of things, which would be part of a site plan modification, so that's a little bit of a different thing. But I think 108 is, or no, 102. Yeah, I'd say 102 is what we would.
More units? Okay,
Of independent living units.
right.
And again, independent living is assisted living. It's just a subset.
2 apartments, okay.
So our argument would be, in adjusting to economic conditions, and that fits one of the criteria for why we be making a site plan modification, this is a way for the town to get significant increase in commercial. And so we think we kind of stumbled our way to something I think that's a rather elegant total solution. Because I never thought we were going to increase the amount of commercial from, day one to now, so.
I have a question on the proposed terminology. And I'm going to read it and then tell you what my question is. So it's in the proposed amendment, and it states, it's the number 1. Commercial use means any use set forth in this section, 9.17.2.b, as being recognized and permitted in a MUD other than residential units. So that means to me, any other use listed in 9.17.2b other than residential units would be considered commercial? And there are some that jumped out at me as not, what I don't think of as commercial, such as schools, colleges, and universities. Churches. I wouldn't consider those to be commercial use, right? If I'm understanding that right,
And dwellings.
yeah, dwellings, right. I think what I'm understanding that to mean is that anything in this list other than residential units would be considered commercial use.
I would just, under the Commerce Clause of the Constitution, commercial, and we did look at this as part of this, it's a very, very broad definition. Almost anything is commercial, if it has even a even a church or a, that's still, there's an activity, that's probably the worst example, but, it's, it cuts across the case law, the state case law, as well as the federal case law and the Commerce Clause of the Constitution. I mean, it's a good observation, but I do think that it is appropriate to classify anything other than the kind of housing we're talking about, and then we drill it down. I did come across some of the kinds of services that would be, you need to meet the criteria of, there's health and wellness, specially equipped fitness centers, on-site clinics, regular visits from healthcare professionals, health screenings, flu shots and wellness, recreational facilities, spaces for social gatherings, swimming pools and spas, I don't know about that one, but transportation services, shuttle services, scheduled bus services, educational and social programs, dining services. Again, Dan can talk about what that might be, but accessibility features, mobility aids, emergency call systems. These are all the things that the federal government has laid out, because they want what you want. They don't want it to be, a wolf in sheep's clothing, so to speak, in terms of senior facilities. So.
Okay, other questions from commission members?
I have a question for Dan or Carrie. If this were approved with this language, Dan, healthcare institution, then anything that falls under that, our current definition, healthcare institution, would be able to potentially be built in the MUD.
Correct.
And there would be, what kind of justification for denying any of that would there be if we've already put it in text as it's stated right now, healthcare institution?
So, I think,
Do you know what I'm saying?
yeah, certainly. I mean,
Getting it?
that use is allowed in every zone but the industrial zones. But I think you'd have to, if it was a large facility, up to 30,000 square feet, and I'm not sure if this is correct, Carrie, so please weigh in. It may be a burden on the services of the town, an overly undue burden. I'm not sure the town could facilitate such a large facility, say for drug and alcohol rehab, but again, I might want to defer to Carrie on that. Certainly you would have to, cite something within the regulations in order to do so.
Yeah, I don't think you're questioning the size of the facility,
It's not the size.
It's the uses.
It's the uses. I mean, if we say, okay, we approve a 130,000 square foot
So-
use for healthcare institution.
So if the owner of the site found a use that fit that definition and they put that forward,
Yep.
that's certainly something you would have to entertain.
Right, but we would be hard pressed to deny it if it's already in the regulations as approved.
Potentially.
Just like,
But I think that's what this sentence was.
Well,
for,
so
right?
the 55 and older, so I guess it would have to be a healthcare institution that somebody 55 and over would live in?
Dan?
This is the thing that was added.
In this, as the regulations are drafted, you couldn't do 130,000 square feet with anything other than what we're talking about. You're maxed out at 65,000, so you can't get any of the.
Well, I think she's saying a healthcare, the other components of the
Oh,
healthcare
I thought you,
institution, those
somebody
other
mentioned
uses.
130,000 square feet, you could have it.
I did.
and
I was saying
you
it's
can't- But
unlikely something.
you can't, unless, to get to that level of size, you would need to be doing what we're talking about doing. That's all, I just want to clarify that.
Yeah, so certainly those other uses are possible, but, they're also, again, like I would say to another large apartment complex coming in, I think it's more likely someone would build a standalone and not go through a mud process in order to get a healthcare institution. You could simply apply for a healthcare institution in the B3 zone, or the B2 zone. But you are correct. If they did propose something within that definition, that is possible that you may have to prove it. Now, also, per Rob's suggestion, I think it's a definition that we need to go back and look at, and that's something that we could tighten up based on your concerns.
Yeah. Okay. Thanks.
Other questions or comments before we open it up to the public? Okay, would any member of the public like to speak? Okay. Ben? Sure. Just a reminder, please, there is a 5-minute limit for each session. So,
Ben Serb, 139 West Cotton Hill. So I like the direction Dan's heading in some ways make me very nervous, and you guys are asking me you guys asked a lot of good questions. Part of the problem, so big picture, I guess I'll start with the end and then go back to the beginning. At the end, I think we're going to have to tighten up our healthcare institution definition prior to any change, or we're going to be in big trouble. I do believe we can do that and then work with something. The problem I'm seeing now, even what was presented tonight, you would have to deny it if he demanded a vote. If you read our definition of institutional health care, it states a hospital healthcare facility for the handicapped, okay? Remember that. Mental health facility, alcohol or drug treatment facility, an infirmary. Nothing he has said tonight meets any of what we have. So, having said that, we're going to have to tweak it if he wants that. That's fine. Right now, hang on,
Okay.
my 5 minutes. This doesn't meet it. What's proposed tonight does not meet our institutional health care, our definition, because that's what this is about. So the biggest thing is, I want to talk about the 130,000 square feet of the 195,000 is basically, it sounds like now, just apartments with a little bit of assistance to them. That is not in any way what our definition of healthcare institution means. So basically, we'd be opening this up to a 55 and older tower with some amenities. That is nowhere close to what our definition, back to what Carrie was saying, because I have a feeling Carrie was actually reading the definition while during tonight's meeting, double checking it like I was, and nothing that was said tonight meets that. And a few other things, most of the time when it was mentioned tonight, it's a broad definition about age-restricted housing. There was one, the attorney used one phrase, senior housing. These are not in our definition of healthcare institution. We have a different idea of what that facility was to be. But my biggest problem is, if we do go down this route to help the developer finish this project, whatever, we can work together, but it should not be 130,000 square feet. That's 3 acres. I do believe we need to define the number of bedrooms if we're going down this road. We need to define, I get a little nervous that somebody in the apartment can be under, because they're saying their apartments are under 55 and older. That's kind of not going down the right path. And the bigger thing is, if we're going to call them assisted living apartments, which that's been what's stated, we're not allowed to have more than 240 housing units on the site. We're back to that other war, and I'm glad you guys did a great job vetting that. And I'm not trying to crush this completely, but I do want to protect Portland, and I want to make sure we get the language right, and I'm sure we can work together and tweak something. But right now, what's proposed, if you go verbatim, word for word, under healthcare institution, you'd have to deny it. And I'm not saying do that. I'm saying we should work together and maybe figure out how to iron this out in a way that we are protected and make sure we know what we're getting, and it's not just another 108 or so apartments that are age-restricted, 55 and older. Am I at my limit? Because I don't want to go over.
I got 1 minute and 30 seconds.
All right, so basically, moving forward, when we do finally, or try to work something out, if that's your guys' intent, I have no idea, you would definitely want to define, number one, number of bedrooms. You'd want to define where we're going with who's living in these things. I've heard now it's been tweaked that somebody in the thing can be under 55 and old. That's not what our definition under healthcare institution, none of that. So we're all over the place, and I'm just trying to iron this out, I'm not trying to blow up Dan's whole project here. I'd like this thing to get completed. I do applaud him for coming in with something different, but I really want to make sure you guys have a lot of problems here, because if you change this and you put that into the mixed use, the way it's written, we have serious deficiencies as a town, and he could leverage that, and we would be in big trouble, and he would win. I would like, whatever we're going to change, it to be very specific, accommodates him as long as we're comfortable, but not open-ended like this. This is all over the place. This is too broad. I'll come back up in a minute, but I'm
So
sure.
go. You silly.
So just to point out, if you keep reading the definition of healthcare institution, no, you gotta wait. The last sentence states, any multifamily dwelling that serves a specific population and provides services, correct?
The specific population listed above. Read the whole thing verbatim. Read it verbatim, and you will find that it says,
Does it say listed above?
yes, it says designed for a particular population. The particular population is what's stated above.
The particular population could be 55 and over.
No, it could not. Ready? Once again, here we go. A hospital care facility for the handicapped.
Okay,
Hang on. Comma. Mental health facility. Comma. Alcohol or drug and treatment facility or infirmary. Where do you get in our definition 55 and older? Hang on. I want to hear. Just answer that one
It does
question.
not-
You gave me a rebuttal.
Does it say listed above? I'm
Dan.
not here to argue with you, Ben. It does not say listed above, does it?
It does.
It
Any
does not
any multifamily dwelling unit designed for a particular population that requires the on-site staff and considered an institution in this definition, Dan.
It
Where are you
does-
pulling that out of?
It does not say listed above, does it?
Or in
says-
this definition.
It says.
Then I rest my case. You're right. Then it's too
it says
vague.
a
Exactly what I
particular-
was just saying. Thank you.
Well,
You just finished my argument for me. You just put on the record that you and I are looking at this completely different, and we need to iron it out before we do any changes. I need to thank you right here. Anybody else?
Ben, all right, enough. Please, wait again for your next 5 minutes, all
No
right?
problem. Thank you.
Also want to point out that the USC section that's listed here also allows for housing to be intended and operated for occupancy by persons 55 years age or older, and at least 80% of the occupied units are occupied by at least one person who is 55 years of age or older. So the USC pretty much allows for not 100% of the people living there to be 55 or older. It allows for some leniency for people who are under 55.
But we restricted it further, and you are allowed under that statute to further restrict it. So we went beyond the 80%. So the 80% would not apply here, the 100% would.
Any other member of the public who would like to speak? Yes, sir.
Norm Iman, 20 Hall Hill Road. Just a concern that I'm looking at here. Assisted living. He mentioned that they would have some type of food. So that means there would have to be some type of a kitchen set up in this building on this parcel that he's talking about. And then something about a rooftop restaurant. Well, if you're 55 and older, do you really want a rooftop restaurant over this complex that he's proposing? They're going to have some type of food service, so they're going to have a kitchen area. So I'm sort of concerned with that part of it. It really wouldn't mix. And I guess my other question would be, is if, say you had parents and a parent passed away, and their son, who is maybe 40 years old, 45, can go into this complex, and then that parent passes away, does that person have to be lack of better terms, I guess evicted. And if he marries somebody younger, that means you have a younger two people in this area. So I don't know how that works, to be honest with you. But I would be concerned about that because now you're starting to put younger people in there. So I think you have to figure out if at 55, it's 55. Thank you.
Just to speak on it narrowly on managing a community with an age restriction, you would have in a surviving partner scenario, the next time that lease comes up, if they don't qualify for extension, then that would be the end of that tenancy, and they would need to move if they were not 55. It's standard practice.
Dan, I have a question. The rooftop restaurant, is
Yep.
that going on top of this building?
Yes,
Thank
the
you.
concept is for it to be on the western wing on the top floor, closest to the bridge.
Thank you.
Sure.
So again, just a reminder, let's filter out the site-specific discussion, because this is a general text amendment proposal. Okay, would any member of the public like to speak for the first time? Okay, seeing none, and would anyone like to speak for a second time? Yes, sir.
Seeing that this is a mixed-use development, it's already at its max capacity of 240 residential units, then I'm curious how the sentence, any multi-family dwelling unit in the institution definition could then apply. There are no more multi-family dwelling units in this site. How could that then apply?
So based on the proposed regulation change, they're saying that a healthcare institution is a commercial use.
No. Back to
Which
our
is
reg.
separate.
Hang on, you mentioned
I did.
in our reg, we have a caveat that says any multifamily dwelling with services.
Is
How
considered,
could we have more, hang on, I want to pause right there. How can we then have more than 240 residential units on this site, or any site for that matter, so we're not site specific?
so what does the end of the sentence say? It's considered an institution, correct?
No. So it says, if you have any multifamily dwelling unit, okay, so you have to have that component. Do we both agree?
Yep.
You need to have that component.
Yep.
We don't have that component here.
What do you mean?
You would need a multifamily dwelling unit to then convert it into this type of housing,
You
is
don't
what
have
it
to,
says.
you don't have to convert it.
It says any multifamily dwelling.
So there's three components of that sentence. Multifamily
Okay.
dwelling units,
So don't we have 240 units? So you said the word unit, hang on. We already have 240 units on this site. How are you going to come up, or any MUD site, how can you exceed the 240 units?
again.
I'm just curious. How
Look
how
at
could
the-
you possibly,
Ben,
maybe we
you
need
keep
Carrie.
reading part of the sentence or part of the definition. If you read the whole definition, you have the three components, a multifamily dwelling unit, on-site services for a particular population, it is considered an institution.
Okay.
And so they are
Once
not
again,
considered
just so you can't
dwelling-
say, just so, I want everybody to hear this. Any multifamily dwelling unit designed for a particular population that requires on-site staff shall be considered an institution. Back to, where is my multifamily dwelling unit that you want this to occur in when we're already at 240 on the site? It says any multifamily dwelling unit designed for a particular population. Where's this unit? We've already hit 240. Where's this new unit?
Ben, it's an institution comprised of multifamily dwelling units for a particular population with on-site services.
Where-
It's an institution that has multifamily units for a particular population that provides services is an institution. So those units comprise, those three things comprise the institution, which comprises the commercial
So then how do you
service.
get around the site can't have more than 240 units? You keep using the word unit. You can't
Because
have more than 240
it is
units,
an-
whether they're
it is an
institutional units or
institution.
whether they're fair market or whether they're 55 and older. Our regs don't allow more than 240
Okay.
units. So how are you getting around that is my
The
curiosity.
use is a healthcare institution. It's not residential units.
Okay, then why are we calling them that? Why have we been stating that the residential units? Why are we stating there can be people?
Because that is part of the definition that the applicant is trying to achieve to meet the definition of institution.
So do you agree there's a lot of area here that has to be ironed out? Do you agree there's a lot of things here that need
Well,
to be
that-
tightened up, or we're
that
gonna
would be-
we're gonna be in a, if we add healthcare institutions to the mixed-use zone, first of all, the mixed-use zone, we wanted retail and all that. I understand he's trying to be creative and come up with something else that's gonna work. But be very careful
I'm
here,
not-
because it opens up, back to Victoria's point, it opens up everything else in here. And we need to iron this out if we're gonna allow another use in that zone. That's my point.
It doesn't open up everything in there. It has an age-restricted component to it.
Right, but
So you can't open a drug and retail, a drug and alcohol center for you.
But
for
the
you.
age-restricted component that he's citing and adding to it, also then, it's the same language used in a 55 and older community. You then are allowed to have somebody
So
in, hang
I'm
on.
not here to debate you on this
I don't want
point.
to, so hear me out, what I wanted on the record. So then why are we allowing part of this component, which is supposed to be an institutional, part of this component, we're dabbling into the apartment component. Are you following me?
I understand that.
Okay.
But based on our definition of healthcare institution, if you meet those three things, you are considered an institution.
I just want to know how you exceed the 240 units. If you're saying he meets the multifamily, where's the
Because it's an
multifamily?
institution, Ben.
Where's the multifamily?
And honestly, if this was approved, then that would have to be presented in a modification, correct? And again, I'm not here to debate this with you, all right? You're probably at 5 minutes again. I mean, I don't know what to tell you.
I'm just saying, we need to iron this out.
So
We need
if
to get
you-
it right. We can probably find happy ground, but we're gonna need to tighten this up before, that's my,
I don't disagree that healthcare institution needs to be
Yes.
looked at, the definition.
We both agree
For
with that.
multiple reasons, but I'm just telling you, that's all they're trying to meet in the last sentence. But again, I don't want to get into like the site-specific stuff because that would need to be fleshed out at a modification.
My point is, if we do allow this broad of a change into a mixed use, keep in mind, we have our residential component. We've maxed it out. We now, obviously, and I give him credit, he's trying to be creative on the commercial. This is still heavy residential. We need to get it right. You're still talking 3 acres more of residential. 130,000 divided by 43,560 is
Well, again,
2.9 acres, 2.99.
the proposal is up to 130,000. All right.
Which is huge. That's my point. I just want and you guys are asking great questions. I'm not trying to derail this, but I do believe there's a lot of stuff here that needs to get ironed out, and Kerry needs to be involved, and we need to get it right, or we're gonna be in big trouble, because there's a lot of things in here under health care institution he can bring in and bankrupt this town in a week, and then we're gonna be switching it to apartments to appease them. So just be very, very careful. There's a lot of exposure here. Get it right. That's my point. That's all.
If I may?
Point.
Okay. Everything at the end of that was wrong. There's no economic risk. This is an enhancement in the commercial that I never even contemplated. So we landed at a good spot. I will say this, and it has nothing to do with anything other than my time allocation. I will not come back to propose another regulation change. And so this is absolutely the best I can do for the town of Portland, but it does have to be now. So we have done a lot to keep this job moving, to get it started and to keep it moving. And I think this is a very creative way. I think you'd be very, very pleased with the results. no regulations will be perfect, but we are out of time. On my side, I'm out of time. So I've been working towards a solution for a long time, and this addresses a lot of stakeholders, and I hope we can do something, and I understand if we can't, but please do understand also I've done the best I can on this. Thank you.
So if I could just go through what I understand the process would be. If this text amendment proposal were to be approved tonight, there would be, or any time in the near future, there would be a modification request submitted by the applicant, which would be site-specific.
That would be my understanding, yes.
I have to give it my best. In that process, I would offer, and this is a strange thing to hear from the applicant, but through conditions of approval, you could put controls on some of the things that you're looking to tighten up about the healthcare institution. So I just want to point out very transparently and openly, that is a way you could constrain this, because I'm very unlikely to appeal an approval. So there are ways to regulate this, and I'm sure Carrie will have opinions on that, but I'm just telling you. Thank you.
Okay, would any member of the public like to speak for a second time? Or a third time?
If for some reason you did want to approve this, I know you've done dates where you push it out. I don't think you should even go down this road, but I want to at least put it out there in case you do, in case, you know, Dan does get approval. I still think there's too much open, but I would say push it out enough time for you to then fix your healthcare institution to get what you want. I don't recommend you go down this road because you're allowing the use in a mixed use. You're basically putting more residential into a commercial, you know, we were hoping to get more of a commercial component. I get it. I'm not trying to completely kill this, but that is a lot. And keep in mind, one of the things, you don't have to vote on it the way it's written. If you want to shrink that number, that 130 is a massive number. That's, I believe, the same footprint as E or F. I can't remember which one. I think it's F, which is all residential. Doesn't leave a lot of room for anything else if you're looking to put, these are big numbers. These aren't little changes, so I'm just trying to give you guys options. So I would say if you were ever going to consider that and lower it at the very least and then push it way out and fix your healthcare, because you've got major exposure for the town. If we don't fix that healthcare, there's huge exposure. I don't care what anybody, I mean, read it. We can get anything on that in a mixed use. And if you're comfortable with adding that to that zone, that's on you guys. But if you're not, you know, but whatever. I think we have a lot of exposure here. I hope you guys see it, but thank you.
I'm still struggling with services. I'm still trying to understand, you know, we've taken a bunch of units and we've basically, now we're calling them commercial because they're a healthcare institution. And I'm struggling with trying to understand what exactly is being provided. So what is creating this change? And I need to understand what services are being provided for the apartments in E and F, right? E and F. I would like to know what those services are. And then I would like to know what the proposed services are for this thing. And I want to look at that and say, yes, this makes sense. This is an additional level of service for independent living over 55, or it's really just a bunch of apartments for people over 55. So that's what I need to see personally. That's what I want to see. I don't know about everybody else.
Shall I address that?
Oh, yeah, if you want to respond, sure.
Sure. So amenitized apartments have things that we have scripted throughout. So you've got, the pool is an amenity to probably the entire complex. First floor of the Brainerd House, there'll be shuffleboard and billiards and things like that, just a group amenity. There are courtyards. There would be places to hang out outside. There's a gazebo in front of the Brainerd House. These are luxury apartment amenities. I think that the difference here has everything to do with the particular population, which we're calling age-restricted, and on-site staff, the required on-site staff. And that threshold involves medical services. So that is the distinction. It's the extent of medical services that we can debate. And if we overdo the requirements for the medical services to be such that it makes it hard for us to justify the rooftop restaurant, then I think we have to pivot. We looked at the regulations, and it is very clear. We've had a lot of legal review on it and everything else, that that last sentence of institution healthcare means that housing, this multi-family dwelling units with those characteristics are an institution, and that's commercial. That is the seed of this whole idea that made it possible for us to come back, as opposed to just saying, throwing our hands up and saying, we're never going to get anything on the same page. So it is a medical service. That's the distinction. And so the fact that that weaves in with other things, and Dave hit on some other things in terms of shuttles and coordinated activities and things like that. But I think the fact that there's on-site medical services is the distinction, and I think it's an important distinction.
So on-site medical services meaning?
Meaning nurses could come to a unit. They could help you track your medication taking.
So you're saying that would be a staff person? I'm not talking about a visiting nurse. I'm talking about is that a staff person?
There are different models for how you deliver that. Right. So you could have on-site location with that service being, and this is all just liability managing, but you could have an on-site service provider who takes care of the people in that building. And so it's not necessarily a direct employee. There are all kinds of, when you get into real estate, everything is sectioned into ways that are limiting liability. So you would not have nurses on your staff as the owner of real estate. You would contract services to be provided at a location. And so the delivery mechanism doesn't change the experience and the overall service provided. It can be sectioned into multiple parties that deliver a total solution.
And just getting back to the meals, I'm unclear. Will there be food provided for these people at all, or are they just going to be, like living in their apartment just like normal, regular people under age 55?
Yeah, certainly the idea and my vision of it, and this is where there are many ways for assisted living to be structured that are more on that independent living slice. And if I am too transparent in my thinking, I can live with that, because I'm trying to just tell you what my last ditch effort is here to be,
I'm sorry, but so what is the answer?
The answer is that I expect that we would have food available to eat outside of the unit and the ability to create your own meals within your kitchen in the unit. So you would have both.
So
and that's,
you would be providing meals of some sort.
I believe that that is a service that independent living facilities offer that I would condone implementing in our version of independent living, which is inclusive, which is under the umbrella of assisted living. So yes.
And housekeeping?
Yes.
Would you do housekeeping?
Yes. We would offer it as a service that would be paid for individually, discreetly, because if somebody doesn't want it, they don't need to have to pay for that. But yes. And that is those are services that distinguish from an amenitized apartment complex.
Can I ask a question?
Yeah.
When you say on-site medical services, is that, would that take up another bit of commercial?
Yeah, typically
So
that
it
type of
wouldn't be in
facility.
the part of the 130, it would be, I know
Yeah,
we're
no, it
getting
would be a
site
component
specific,
of that
but
space. Yes,
it would be a component of the 130.
yes.
So it
A
wouldn't
piece
just,
of
it
that.
wouldn't be like a separate medical office that would be
It'd be in that building,
leased.
just to make
Okay.
it that much more easily interacted with. But that is, those are the tweaks to the model, where you're shifting some of the spaces around a bit to deliver for this population.
So I recall, and Victoria reminded me, one of the issues that was discussed when we were proposing the previous proposal was the additional load to the sanitary system. And with this proposal, I believe we would still be adding that load to the sanitary system with these additional
Even more. I think.
residences.
You would have, the sewer and water usage is across the spectrum of commercial outcomes. I mean, I think the sewer and water approvals from Mr. Fonda's application years ago exceeded anything that we've proposed, I think inclusive of this. But the usages, traffic counts are all lesser in an age-restricted population than they are in their unrestricted equivalents.
But we're talking about 100-plus kitchens, plus a kitchen that would supply food for the whole building, and 100 and something more toilets.
Right.
and
The argument that
Potentially 200 more
what-
people.
What I've tracked in town, this is my analysis, there are improvements that need to be made to the infrastructure, period, full stop. It's why we're trying to get grand list improvements so that it's easier to pay for them. This type of use and this amount of commercial is a significant taxpayer because the largest operating expense is school-aged children. And so the dollars that come to help with those issues far exceed the costs. And so this is typically something that's welcomed in a municipality to help cover these operating costs because they are there. I mean, the stuff that has to be done for the sewer and water systems in town are independent of these projects. There's certain maintenance that has to be invested in.
Just another question about the whole, the structure, the fee structure for these are apartments, right? I mean, there's no buy-in or
There's no for sale component to it. It is a, duration of stay is, I would have to
you have
investigate
an
further.
annual lease and you pay by
Yeah,
the
you would have
month.
some, but in this, I would have to drill down more I know the rules of thumb on apartments. The duration of stay here, I would want to investigate and give you the typical, but I don't think it really, the use is still the use and all these other things. I'm confident about everything else I've said. I don't know the typical.
So you would expect that people are going to move in here, they're going to be over 55, and they're going to stay for however long they want, and if they start to get to a point where they need additional services or what have you, then they'll be moving out.
We'll follow some best practice for how they can move to some other care facility, but it'll be following industry practice. I just don't want to make anything up. I don't have that answer. I will know well in advance of operating it, but I don't standing here now.
Other questions or comments before we close the public hearing? last chance for members of the public to speak. Okay,
No one's on Zoom.
Close the public hearing, aren't we gonna get more information?
Carrie.
We're gonna talk about the.
I'm here.
Carrie's here if you have questions.
Well, I don't know.
Yeah, I'm here.
The definition piece,
So, you mean changing the definition
well, I mean.
or
whatever-
pushing out the
whatever we were
definition?
talking about. We talked about a lot of things.
I think there's some discomfort in adding healthcare institution to the list of allowable in the MUD, based on the current definition that we have in our regulations.
So I suppose, taking one of the audience members' suggestions, if the applicant's open to it, we could try to push the effective date of the regulation change out, and then certainly pursue modifying the definition of healthcare institution to allay some of your concerns. Certainly, I would defer to probably Carrie as to what would be the best definition of that. If you wanted to change that, certainly we would. I mean, that's certainly a possibility. If the applicant doesn't want to do that, we certainly could proceed quickly and look to change the definition ourselves. I could receive it and try to put something together and receive it in August 1st, and then we could hear it at the next meeting that we meet and get it done in August. Either way is possible. So it's whatever you guys want to do.
Dan, if we were to change it, my recommendation would be just to change it to be in line with the general statutes. I mean, there's no point in having something that contradicts what the state has.
I think that would probably be the best course of action.
Dan, I don't know about anybody else, but I couldn't hear what he said.
Carrie, like we had spoken about, Rob was suggesting potentially if we were to change the definition of healthcare institution, to change it to what's enshrined in statute now. So as that statute changed, our definitions would evolve with it. I don't know.
That's in line with what we talked about.
Right.
I just want to say, and again, I am not advocating one way or the other. Currently, there's only one application before you using your old definition. And I'm hearing you that you feel that it's opening the door to other types of healthcare institutions in the mud that you might not want. And so I would say to you, and again, because that definition is so antiquated, I would suggest to you that you change it post haste. But I don't know that means that you can't make a decision on this application while you're amending it. And I say that only because, I mean, if you knew somebody was gonna rush in tomorrow with an application in the mud to do something like this, then I would say you'd be justified in forestalling. And I'm gonna say you're justified in forestalling because you're the Planning and Zoning Commission, and that's okay too. I just think we ought to look at the reality of the situation and whether there's a real risk if you're committed to changing that definition post haste.
So,
Just
Dan,
for thought.
I mean, if we change the definition to be in line with the general statutes, it wouldn't have any impact on, I think, from what he's talked about today, on what the plans are in the future. So I think we'd be fine with making a vote today and looking at it, at our next meeting. We're submitting an application, doing what we need to do for a text amendment change to change it so it's current.
So I haven't read, I would have to defer to you and Carrie, who have potentially read that current statute. I can't answer that personally. if that's what you wanted to do, I'd get an application together and we receive it at the meeting in August, and then we'd hear it at the next meeting. So that wouldn't be that hard to change for me, because it's not like we're coming up with our own definition. It's not like I'm having to hem and haw through these various uses. Could you get thank you. Get through the various uses. So it would be a lot easier for me, with Carrie's assistance, to draft such a definition change. So that I can certainly turn around.
Dan and I had talked about having it just mirror a relevant statute, whether it's one from the Department of Health or whatever you all are comfortable with. And there may be things, again, because healthcare institutions have become, it's forever changing. The types of healthcare institutions that we're seeing are forever evolving. And so to have a regulation that simply adopts the definitions of relevant statutes means that they get updated as those statutes get updated. But that may not give you a level of comfort. You may look at those definitions and say, oh, well, I'm not comfortable with this, or I'm not comfortable with that. And that's okay too. So we clearly have to get you the information so that you can think about what that definition should be. And again, if you're that uncomfortable and you feel that you need an extension of time on this application, that's fine. I was just trying to make the point that I don't see a real risk right now of the approval or denial or decision on this suddenly causing somebody to come running in tomorrow in the mud zone for $130,000 healthcare, 130,000 square foot healthcare institution. And I just throw that out there for you, because Dan and I can work fast, right, Dan?
You got it.
We can work fast.
Yeah, my other point would be, it's currently allowed in all the residential zones and all the business zones. Somebody wanted a 200,000 square foot healthcare institution, they wouldn't go through an MUD. They would just propose a 200,000 square foot healthcare facility on a piece of property that met the definitions in that zone. So really the only risk factor in this change currently, I think, as Carrie's saying, is if you think the current MUD would come in with something that you don't, you distrust, I guess, or however you'd like to put that. So, I mean, it is an option right now, regardless of if you change this. If somebody wanted a 130,000 square foot healthcare institution, they can build it in one of our existing zones without meeting the higher, more rigorous criteria of the MUD.
And let me be clear, because I don't want to minimize this. Your fears are justified. The definition is way too broad, way too antiquated. And somebody could potentially come in with one of the other types of defined healthcare institutions and claim one of the smaller commercial spaces. I mean, who knows, right? The point is, there's nobody banging at the door to do that. And I think we can change the regulation before there's a real risk that might happen. But I'm not going to minimize your concern. I think you're justified in being very concerned about the current definition.
And I guess along with that, when we review that definition, you could also potentially review the zones that such an institution could be allowed in as well, if that is a concern. So if you don't think it's appropriate in B1, then that's something that could be changed as well.
Am I able to ask Dan a question?
Yep, public hearing is still open. Yes.
Dan, how did you come up with the 130? How did you come up with the 130? Where did that number?
Yeah, so when we first took the cut at this, before we were kind of collaborated our way to making this an addition to the MUD, we had looked at the site and said we could take that southwest portion, and because it's in the V3 zone, and we have 14 or 15 acres, right? the mud requires 10. So we looked at it as you could have a mud across one part and develop a healthcare institution on the southwest piece, okay? So we did this analysis where it has a restriction for 35 feet in height, and so you would then have to draw the building across. So as we shared some of our analysis about what we thought could be done on the parcel, because the first ask after the last motion failed was, how do we get the B building? Because that's kind of nice, right? And we said, well, we have to make A cash flow. So it's really a math problem where you're saying, okay, how many square feet can you get to perform that then allows you to justify the risk taking on creating that B building on the corner. So it's all very formulaic about where the perceived risks are. And we just felt that the mud has the mechanisms for, when it's a mixed-use building, to go more vertically. And we had those exhibits showing that the enhanced view shed of the historic buildings was so much better with that A building shifted to the east and more vertically oriented. So it was a calculation of spaces where we could economically model how to take on these other speculative commercial uses on the site, because after all this is said and done, there's still 70-some-odd thousand square feet outside of the healthcare institution of commercial space being built on this project. So the idea is you're trying to figure out, in an environment that is damn near impossible to build commercial on spec, because there's so many big buildings that are just getting repurposed and reabsorbed, we had to figure out something that would pencil out. So it was a pure economic analysis. Okay.
I'd like to remind people, because I know the numbers in this proposal got some attention, but let's remember these are maximums, right? And could be and probably will be revisited if and when there is a modification application that comes in. Right? These are maximums. So based on what we've heard, do people want to leave the public hearing open? Are we comfortable closing it? What's the consensus?
I'd like to close it.
I agree.
Anyone else want any more information? Okay, hearing none then, may I have a motion to close the public hearing, please?
So moved.
And a second?
Second.
All in favor, say aye. Aye. Opposed, say no. Okay, the public hearing for application 23-20 is closed. Any further discussion?
I think we hashed it out pretty well.
Yep.
You know, as long as we focus on making those changes to the definitions coming up, you know, soon, then, you know,
Yeah, I'll get an application in for receipt for August 1st. What would you like the effective date to be?
For this text amendment?
Yep.
Well, let's see.
The default is 15 days after publication, but you obviously have to have a motion to approve it and have it be approved before any of that can happen. So that's the default position, is the 15 days, but I leave it up to you.
If it was the 15 days, it would be like August 3rd or 4th would be the effective date. I mean,
You could even just say the effective date will be 15 days after publication. But if you want to set a specific date, you just have to make sure that you leave enough time to get it published.
yeah, so I mean, with that, we would have the definition received in. Carrie, would it be a problem to just push it back to the 16th?
Push what back?
I won't be here the 15th. Well, I just didn't know, because it's up to you guys.
I'm sorry, what was the question, Dan? I didn't understand
Well,
the
I
question.
just didn't know, I mean, we could potentially get that whole definition done in another week. I guess it's only a week time that it would be like that, so it wouldn't be that big of a lapse.
But that would be if we all agreed that what the definition
Right.
by the state was something that we all liked.
That's
And we haven't
correct,
even
yeah.
looked at it yet.
Correct.
So I think a week is kind of
Okay,
pushing it.
that's true. That's a good point. Okay.
No, I think, well, so let's just say that you close the public hearing, you actually have, 65 days to render a decision at this point. So if you want to forestall your decision, you can do so. Obviously, the change in the text amendment would not apply to this application. In other words, they're entitled to go under the regulations and the application that's pending today. So any way you look at it, you either have to approve or deny what they have proposed to you this evening, regardless of what you do with your definitions going forward. The only time that they would be beholden to a new definition would be if the effective date of that definition preceded your decision on this application and they agreed to be bound by it. That's the only way. Otherwise, they have a right to rely on what's on the books today and what they're proposing for a change.
Yeah, so we do need a new submission by the applicant in terms of a modification, based on, the regulation change. So if the applicant wanted to come in for a modification, they still need to submit a new application and have that received as well.
Didn't Carrie just say if the applicant agreed to, Carrie, what did you say
Did I misunderstand that, Carrie?
about the applicant agreeing? There were two conditions.
Okay,
said-
so you have 65 days to render a decision on what's in front of you right now. And because their application is already before you, and you've already had a public hearing, any modifications that you make to the definition of healthcare institution after tonight does not apply to this applicant unless they agree to it. So, and they would have to, because again, they have a right to rely on what's on the books today. That's what they came in under. That's what, their application is centered on. And so, so again, if you're okay with the text amendment proposed tonight, for right now, you can approve that. You can do the text amendment going forward so that some other party can't come in and rely on the definition that as it exists today, right? As long as the effective date of that text amendment precedes an application relevant to it, they're entitled to rely on the old definition. So, so it's all about the timing. And again, so the decision is, do you wait to render a decision on this application, make your text amendment, and then that way foreclose anyone else from the benefits of the text amendment that's before you tonight? Or do you go ahead and approve this application and then post haste fix your definition so nobody else can follow suit? Those are the real questions. Am I being clear?
Setting the effective date of this proposal in front of us in the future really is a moot point. Because if this were to be approved, it would be approved based on the definition of healthcare institution in our regulations as of right now.
Unless the applicant agrees to follow a text amendment, unless the applicant agrees to our changing the definition and adhering to the
That's what it would
changed
require.
definition.
But setting an effective date, if you're gonna vote on this text amendment that's in front of you tonight, you're gonna approve it, you have to set an effective date. And like I said, the fallback or default position is 15 days after publication, so usually it's about 3 weeks out. And so the text amendment doesn't take effect for 3 weeks. In the meantime, you're working on a text amendment to your definitions, and the effective date of that will be set after you decide what that's gonna be. And so that will be, if you receive an application and set a public hearing for a new definition, I'm hearing Dan say August 1st, you would receive it, set a public hearing on changing the definition, and then again, you're probably talking 2 or 3 weeks after you vote on that before it's effective. So they'd sort of be in lockstep, but you do have to understand that because this application is pending in front of you, you have to look at it based on the definition that's sitting there today. They have no obligation to agree to any text amendment regarding the definition of healthcare institution that is adopted after tonight. No obligation. And it may not be necessary, because again, I talk to Dan on an almost daily basis, and I'm not aware of anybody else who's pounding on the door to put a $130,000 assisted living facility in Portland.
I've not had that conversation.
So, but again, I don't want to minimize your concerns. I don't want to minimize them. It's obviously it's up to you. And you do have 65 days to render a decision on this, what's been proposed.
So in my mind, the question in front of us tonight is, do we want to vote on this tonight, or do people want time to consider it?
I'd like to vote on it tonight.
I tend to agree.
I'd like to vote, yep.
Any dissenters?
No, I'm not dissenting.
I'm sorry, you know what?
Are you okay voting on this tonight?
Yes.
Okay. All right then. Do we have a motion, Dan?
Oh, right.
Do you want to start all the way, do you want me to start up here?
Yeah.
To approve application 23-20, proposed amendment to the Portland zoning regulations. Add healthcare institution to section 9.17.2.b of list of allowable uses. Add footnote to 9.17.2.b that states, for purposes of this 9.17, 1, commercial use means any use set forth in this 9.17.2b as being recognized and permitted in an MUD other than residential units. And 2, residential units shall exclude any beds or units within a healthcare institution. Add text to section 9.17.5.f. Notwithstanding section 5.2.b, no single commercial establishment within the MUD other than healthcare institution shall exceed 65,000 square feet in gross floor area, and no healthcare institution within the MUD shall exceed 130,000 square feet in gross floor area. And no MUD shall contain more than one establishment of maximum size, with all other establishments not to exceed 40,000 square feet in gross floor area. Application of BRT DeMarco PTP LLC with changes and/or clarifications to the proposed text amendment as follows. Section 9.17.2, 25, healthcare institution. C, commercial uses. For purposes of this 9.17, commercial use means any use set forth in this 9.17.2b as being recognized and permitted in an MUD other than residential dwelling units, provided, however, that residential dwelling units shall not include beds or units within a healthcare institution, which requires that 100% of the units be occupied by at least one person aged 55 or older, and meets the requirements of the Housing for Older Persons Act 42 USCA 3607B2. Section 9.17.5 F, maximum area of any retail establishment and proportionality. Notwithstanding Section 5.2.b, no single commercial establishment within the MUD other than a healthcare institution shall exceed 65,000 square feet in gross floor area, and no healthcare institution within the MUD shall exceed 130,000 square feet in gross floor area, and no MUD shall contain more than one establishment of either maximum size. All other establishments not to exceed 40,000 square feet in gross floor area. The commercial retail element of the MUD shall contain opportunities for smaller retail and/or commercial establishments with not less than 25% of the total retail and commercial element area dedicated to retail establishments of less than 10,000 square feet each. By way of example, if the total proposed commercial retail establishment square footage is 125,000 square feet, then 31,250 square feet must be shown on the plan as being dedicated to commercial retail establishments of less than 10,000 square feet each. Effective date, 15 days after publication of legal notice. I don't see reasons. Are there no reasons?
Oh, I must have left them out. I'm sorry. It would just be, it's consistent with the town's POCD.
Okay, reasons consistent with the town's POCD.
May I have a second to the motion?
Seconded.
Okay, we'll switch up the voting this time. We'll begin voting on my far right, so that would be Rob.
Aye.
Jen?
Aye.
Chantel?
Aye.
Victoria?
Aye.
I vote aye as well, so the motion passes and the application is approved.
Seconded by,
Yeah, Rob seconded that. Yep.
okay. I put reasons, Dan, I wrote reasons
Okay, thank you.
down there, so when you do it.
Okay, then the only other item here is, may I have a motion to adjourn, please?
Second.
All in favor, say aye.
Aye.
Opposed, say no. Okay, the meeting is adjourned.
Good evening, everybody.
Thanks, Gary.
Thanks,
Thank you, Carrie.
Anytime. I think I'll see you tomorrow night, right?
That's cute. That's cute. I'll see you tomorrow night. I know.
But it doesn't start till 7.
Well, we don't even know.